All right, I want to talk to you a little bit about expanders, which are used as a temporary device that we use in breast reconstruction after mastectomy. This is an expander. What it does is it gets put in the pocket where the breast tissue's been removed, sometimes above the muscle, sometimes below the muscle, depending on what other factors go into that. But we're going to just kind of describe this procedure with this in mind, that this is a temporary device, like I said. So we put that in, we can deflate it at the time of the surgery, which allows the tissue to heal safely and without over compromising the tissue. And then we, in the office, will expand those expanders up, and we'll show a video on that, on adding more volume, which creates a pocket, which allows you to visualize kind of what the size of the implant will look like on you as we're going through that process of adding more volume. And that's usually started about 3 weeks after the procedure, once the tissue is healing well and has a little bit of strength to it, and we'll slowly expand that. Typically, it's about a 3 to 4 month window between the expansion procedure, which can be done at the same time as the mastectomy or done as a separate surgery. But we have that 3 month window to get through the expansions after letting some healing go on, and then schedule and prepare for the next surgery, which is typically placement of an implant. The expander has a port in it, which we access with the fluid that we add to it in the office setting. And then we can remove it and put an implant in place of it. All right, so here's an expander, pretty much deflated. Here's one that's filled up. As you can see, the shape's a little bit not even. It's flatter at the top and rounded more at the bottom. And that helps to expand the lower part of the breast to get a better rounded shape when we're going to put an implant in there afterwards. So here again is the port that we access that here in the office setting by placing a needle in it, adding volume, which then expands this up to stretch out the tissue, create a pocket for the implant to be placed. And we do that slowly so that the tissue is safe and healthy through that process after just going through surgery. The tabs we use in surgery to help hold the expander kind of in position as well as from rotating. And eventually this will come out and an implant will be placed in that pocket. All right, so we're going to show you what the expansion process is like, just to give you an idea, since it's a little bit of a harder concept to maybe grasp. The expander, which will be put underneath the skin during surgery, has a port built into it, and you can see right here that this is a little rubber stopper similar to a chemotherapy port. We can access that, as we'll show here in the office setting, by getting a syringe filled with injectable saline and then a needle at the end of the tubing. And the way that we find it underneath the skin is we use this magnet finder, and as you can see, it moves around and it'll locate the metal on the back of the expander port, which allows us then to clean the area with betadine. And then what we do is we inject by sticking into the port and adding the fluid. And we'll do that as many syringes as we can safely at each visit, just to try to get through the process. And then we'll expand you up to the size that you're seeing that you like, and then correlate that to what kind of size implant we put in at the time of surgery.